Hey everyone, Chris Lewis from Fox 47's Digital Newsroom. Excited to have you back again for another We're Open segment. And today we're talking with Dr. Terry Matthews and Catherine Matthews of Lansing Urgent Care. We're talking to them about what they've had to do. A lot of businesses have had to make pivots. Healthcare is not any different. They're having to make changes too to be able to best serve the needs of the clients that they serve. And we're going to be talking about that today. Dr. Matthews, Catherine, thanks so much for being with us today.
Thanks for having us.
Thank you. Our pleasure.
It is my pleasure to have you here. And, as I said, I think that every business has had to go through changes. They've had to make pivots, and healthcare is definitely at the forefront of that in trying to keep people safe. Talk to me a little bit about some of the changes that Lansing Urgent Care has had to make to be able to best serve the needs of the clients.
We've, like a lot of businesses out there, we've endured a lot of struggle and adversity, over the last month. But we're in a business that fortunately has allowed us to remain open. Our medical business, like many other medical businesses, has seen a drastic reduction in patient volume, depending on the day in the clinic, on the order of 50 to 70% less volume than we're used to. So, the decisions that have to be made that come with that in terms of how do you best keep your staff busy, employed, avoid layoffs and things like that. Those are all things we've had to grapple with. So we've been able to maintain a full workforce. All of our sites are open every day, full hours, including our 24/7 clinic, our overnight clinic at Frandor. But one of the main things we did to try to both protect our staff by allowing telemedicine visits to occur, to interview those people with potential COVID-19, was that we rolled out telemedicine, maybe a week ago. And that's not only accomplished that goal to a degree, but allowed some increased patient traffic, which is helping us to continue to keep people employed. Struggling to find PPE and adequate supplies is an ongoing challenge for us and everyone. But so far, with the work of local and state governments and just, sort of our own internal crew digging deep and finding supplies from private entities, we've been able to keep our staff protected.
Now, when you say that you've instituted telehealth for COVID-19, for other patients that have regular, just day-to-day things, maybe it's the flu, or maybe it's just something else that it's not COVID related, what should they be doing if they're thinking about needing to still get services?
We can see quite a few things via telemedicine, more than you might really realize or think about, sort of at first glance. But we have most of those actually listed on our website. So if you go to lansingurgentcare.com, we have a telehealth link, which will really display everything that we can see from a telehealth standpoint, things that probably should be seen in person, and then those things that should really take you to the ER to call 911. But yeah, we can see things, we can at least give you an initial evaluation for things like flu and strep and, other things that aren't COVID related, chronic conditions, all sorts of things. If your asthma is acting up, that sort of thing, maybe you're out of an inhaler, you need a refill, we can evaluate you to some degree. And, in those rare instances, if the telehealth visit needs to convert to an in-person visit, our provider, our PA doc, will let you know that, and we can schedule you online at any one of our 7 clinics.
Now, if you could say one thing to the clients that you see on a regular basis that you might not be seeing right now, what would you say to them?
I would say that one of the main reasons why we implemented telehealth is so that they can feel like they can still see us and do so safely. I think a lot of people are maybe nervous to come in because they're afraid, it's a place with sick people, so they're afraid that they may get exposed to the COVID-19. And that's in part why we instituted telemedicine, because we thought it would just be a way to make people who are sick and need to get seen more comfortable about getting seen. Also, like everyone, we've stepped up all of our sanitation. We're known for having really clean clinics, and we've stepped it up even further. And so we're really taking very diligent measures to make sure that we're sanitizing all of the common places, the exam rooms, et cetera.
If people want to find out more about the conditions that you're seeing or about the clinic itself, where should they go?
Just go to lansingurgentcare.com they can find all the information about us. They can check in online, and they can register for a telehealth appointment, as well as see what kinds of conditions are appropriate for that type of visit.